Good evening, guys. I have discussion D for you. We're discussing chronic fatigue syndrome, ME/CFS, is strongly associated with dysfunctional breathing patterns such as hyperventilation, shallow breathing, or irregular respiratory rhythms. These abnormalities are not incidental, but appear in strikingly high proportion of patients, especially during exertion. Researchers argue that this may be linked to dysautonomia, a disruption in the autonomic nervous system's regulation of blood vessels, muscles, and respiration. And that these breathing issues could directly worsen hallmark ME/CFS symptoms like post-exertional malaise, cognitive fog, and fatigue. Key findings from the study: high prevalence in cardiopulmonary exercise testing, nearly half to over 70% of ME/CFS patients showed dysfunctional breathing compared to controls, suggesting that this is a core feature rather than a rare complication. Underlying mechanism: dysautonomia is implicated as the driver, with abnormal autonomic regulation leading to poor vascular muscular coordination. Exertion link: dysfunctional breathing was most evident during physical stress, aligning with the defining ME/CFS symptom of post-exertional malaise, the delayed crash after activity. Methods and contexts: 2-day CPET cardiopulmonary exercise test. Patients and matched controls underwent repeated exertion tests to capture breathing patterns, oxygen use, and recovery dynamics. This disparity in breathing dysfunction was clear and reproducible. Clinical framing: reported in peer-reviewed outlets like Frontiers in Medicine and summarized by science news platforms. The findings are positioned as both credible and translational, bridging research to potential symptom relief strategies. Amplification of symptoms. Dysfunctional breathing reduces oxygen delivery efficiency, destabilizes CO2 balance, and worsens autonomic instability. These mechanisms can intensify fatigue, brain fog, dizziness, and the hallmark post-exertional crash. Modifiable target. Unlikely many CFS mechanisms that remain. Exclusive breathing patterns are potentially trainable. This opens a practical path for intervention, even while the broader disease biology is still being unveiled. Potential clinical implications. Non-pharmacologic interventions, breathing retraining, paced breathing, yoga, mindfulness, and biofeedback are highlighted as candidate strategies to restore rhythm and reduce autonomic overdrive. Controlled trials are needed to validate their effectiveness. Personalized assessments, screening for dysfunctional breathing during exertion via CPET or respiratory evaluation could help clinicians stratify patients, identify those most affected, and tailor interventions to reduce symptom burden. System level insight. The findings reinforce ME/CFS as a disorder of systematic regulation, where cardiovascular, respiratory, and neurological systems interact dysfunctionally rather than a condition confined to one organ system. Broader implications. This research reframes ME/CFS not only as a condition of fatigue, but a multi-system disorder with measurable psychological dysfunctions. By identifying dysfunctional breathing as a common and actionable feature, it provides hope for symptom management strategies and empowers patients, while deeper biological causes continue to be investigated. Would you like me to sketch out a practical breathing retraining framework? Something that could be adapted for community programs or caregiver toolkits, given your interest. In participatory and culturally responsive intervention. Okay, guys. So that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.